What does informed consent for amitriptyline look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about amitriptyline, which is otherwise known as Elavil. So amitriptyline is one of our tricyclic antidepressants, which is an older class of antidepressants, and it's going to be a tertiary amine tricyclic antidepressant. So what this means, it's going to affect more receptors and neurotransmitters, and so they tend to have more side effects. So we'll talk about those shortly. So amitriptyline is only FDA approved for depression. However, it's used off-label for a lot of other uses. So this can include things like migraine prophylaxis, insomnia, fibromyalgia, and other neuropathic pain, chronic tension type headaches in addition to migraine headaches, bedwetting in children, anxiety, interstitial cystitis, as well as irritable bowel syndrome. Now, I often do see this medication used in combination with an SSRI. So for example, someone's on sertraline for depression, and then they get started on amitriptyline for migraine prophylaxis. And when amitriptyline is at low doses, this is generally relatively safe depending on the other medications in someone's medication regimen. However, if you're getting to higher doses, then you have to be cognizant of the serotonin load and the risk of serotonin syndrome. So that's one thing I'll say, because it's often used as an adjunct rather than a primary treatment for depression or anxiety. So common side effects are going to be things like dry mouth, dry eye, urinary issues, increased appetite, weight gain, constipation. There can be stomach upset, but like I said, it generally can help with that, but I still do recommend taking it with food. Generally, this one is going to cause people to feel sedated and to feel tired. That's why it's sometimes used for insomnia. However, of course, some people are going to have a paradoxical reaction and it's going to make them feel more activated. If someone does have a history of bipolar disorder, for example, then this medication would put them at risk of something called mania, as well as drowsiness, fatigue, weakness, tiredness. Sometimes people can have really vivid dreams, or they can also have tremors. And the dry eye can sometimes cause blurred vision. As far as more serious adverse side effects, of course, we're going to warn people about the risk of SI, especially in adolescent populations. This medication is also one of the worst ones as far as QTc prolongation, which basically means that it affects the way that your heart beats and could put you at risk of a dangerous arrhythmia. So if you're on this medication, especially if you have a cardiac history or you're taking other medications that can also have this risk, it's important to have an EKG on file to make sure that that QTc interval is normal. There can be movement disorders associated with this, things like tardive dyskinesia or akathisia. It does lower the seizure threshold, and like a lot of our antidepressants, if someone has something called narrow angle closure glaucoma, then this medication would put them at increased risk of having an acute angle closure, which is a very painful eye condition that can lead to blindness. And like any antidepressant, I would generally recommend using a hyperbolic taper approach if you want to come off. And of course, the longer that you're taking this medication, the more challenging it can be to get off. So after going through all this, I would answer any questions they might have, and we would make a shared decision from there. If there's another psychotropic medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future resources or offerings or courses, and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email, and I hope to see you in the next one.